Hello, and welcome to the 36th Bi-Monthly Breastfeeding Coalition's webinar. This is Megan Renner, and I am your moderator today, as well as the Executive Director of the U.S. Breastfeeding Committee. As you know, the USBC and the CDC Division of Nutrition, Physical Activity, and Obesity co-host this series of bi-monthly webinars for state breastfeeding coalitions. And they are held every 2 months in the even-numbered months on the second Tuesday at 2 p.m. So 2 p.m. Eastern Time. So we sometimes refer to them as the 222 calls. That's how you know when they're occurring. And they bring together the state, territorial, and tribal breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. The slides and handouts, as well as the archives of past sessions, can all be found on the USBC website. If you have not already picked those up today, don't worry. You can watch the webinar slides on the screen, but if you are listening by phone or for some reason cannot get into the webinar, you can also reach them on the website. You will simply go to usbreastfeeding.org. And on our homepage on the lower right side, you'll find a quick links box, and there'll be a link in there for the bi-monthly coalitions webinars. And here's just a shot of the homepage. Down here, you see the quick links box and bi-monthly coalitions webinars. So that's how you find the slides. And then after the conference or after the webinar, we will also post the recording on that page as well. So that's the landing place for all things to do with these webinars. During today's sessions, all attendees will be in a listen-only mode, and you will be able to type questions and answers at any time throughout the webinar. However, we will have a Q&A period at the end, but please feel free to ask questions by typing them into the questions box on your webinar control panel at any time during the webinar. I'm going to show you a quick screenshot here of what that looks like. You should have a GoToWebinar control panel on your screen. In case you may have minimized it, if you see a little orange arrow sticking out and you click that arrow, that will make it pop out again and show up. So if you're not seeing the full control panel, click on that orange arrow button. It should look something like this and show that you are currently muted, but it will have a section for questions. If the little arrow next to the questions is pointing to the right, you may need to click on it. Click on the little gray arrow next to questions, and it will open up the question space, and it will say type question here. So that's where you can ask questions, again, at any time during the webinar. I'm going to just do a little introduction. Today we are very pleased to welcome Sadie from HealthConnect 1. Sadie coordinates the Illinois Breastfeeding Blueprint and oversees HealthConnect 1's involvement in communities putting prevention to work. She presents regularly on breastfeeding support for new moms and works with hospital staff and community advocates working towards baby-friendly hospital status. Prior to joining HealthConnect 1's staff, Sadie managed the qualitative data for the Illinois Breastfeeding Blueprint as a consultant and assisted with HealthConnect 1 event sponsorship and outreach as a volunteer. She comes to her role with a background in nonprofit program evaluation and corporate marketing, and with a track record of developing community partnerships with a consortium to lower obesity in Chicago children, also called CLOC, and Heartland Health Outreach, among others. She completed her master's in public health with a focus in maternal and child health at the University of Illinois at Chicago. And Sadie will be presenting today on the topic of the Illinois Breastfeeding Blueprint, from data to strategy to change. So without further ado, I'm going to turn it over to Sadie. Just give me a moment while I flip to her presentation slides. So take it away, Sadie.
Thank you. Good afternoon, everyone. Happy Breastfeeding Month. I'm very happy to be presenting to you today in such a monumental time. And like Megan said, can you hear me okay?
Yep, we can.
I'm going to be talking. Okay, thank you. Talking to you today about the Illinois Breastfeeding Blueprint. You can go to the next slide. Just to give you a little bit of background on HealthConnect 1, we are the national leader in advancing respectful, community-based, peer-to-peer support during pregnancy, birth, breastfeeding, and early parenting. And we do this through replications of community-based doula programs as well as breastfeeding peer counselor programs. Our model includes a blend of training, technical assistance, and different data collection tools for our sites. And we also do some national advocacy around community health workers in maternal and child health. Next slide. Just to give you a little bit of an overview of what I'm going to talk about today, I'm going to share with you the state-specific data that was used for the Illinois Breastfeeding Blueprint. Also talk a little bit about strategies for statewide collaboration in promoting breastfeeding. And then also some of the important policy change initiatives that have been taking place in Illinois in terms of policies that implement the blueprint recommendations. Next slide. Just to give an overview of the blueprint and how it came to be, this was developed in partnership with HealthConnect 1, the Illinois Department of Human Services, and also the University of Illinois at Chicago School of Public Health. And it combines both quantitative and qualitative data that was analyzed for the state of Illinois, and from there, strategic recommendations were developed, and the blueprint was launched in April of last year. Next slide. To give you a little bit more depth into the methods that we use for the data analysis, for the quantitative data, we primarily use the PRAMS data source, the Pregnancy Risk Assessment Monitoring System, and we took a look at data from 2000 to 2008. We did that span of data in order to give us enough information about subgroups. And then for the qualitative data, we hosted 5 community forums that included both mothers and service providers across the Chicago area. And then we used that data to get some more qualitative data to reflect what the quantitative data was telling us. Next slide. So here, just to give you a point to see where Illinois currently stands compared to the Healthy People 2020 objectives relating to breastfeeding. And this is fresh off the press from the 2012 CDC Breastfeeding Report Card. So this represents data from 2009. As you can see, in terms of initiation, Illinois is doing pretty well, getting pretty close to the Healthy People 2020 objective, and not doing too bad at 6 months and 12 months. Where some improvements need to be made is pertaining to exclusive breastfeeding. If you look at exclusive breastfeeding to 6 months, we are only at 13.6%, which is the current AAP recommendation of exclusive breastfeeding to 6 months. A few hospital-related variables to look at is we have only around 1.5% of births taking place in baby-friendly facilities. And then in terms of infants being supplemented prior to 2 days of age, we're about double the goal for the Healthy People 2020. So there's definitely room for improvement, but we are happy at least about the initiation rate. Next slide. So this delves a little bit deeper into the data that we analyzed for the blueprint. This is looking at initiation, and when we were looking at the data, we did have a focus at trying to get to where the disparities were in breastfeeding in the state of Illinois. So this slide is percentage of Illinois women who started breastfeeding their infants, and it's broken down by low income on the left-hand side, and higher income on the right-hand side, and then from there it's broken down by race and ethnicity. As you can see, there are significant disparities among the low-income communities, and both Black and white low-income women have initiation rates that are far below the Healthy People 2020 objective. Next slide. And then moving on to duration. So this is of the women who started breastfeeding, the percentage of those women that were still breastfeeding at 3 months of the infant's age, and not quite as drastic disparities, but we can still see some differences between low-income and high-income women. Next slide. And finally, looking at exclusivity, this is the percentage of Illinois women who started breastfeeding and what percentage were still exclusively breastfeeding at 12 weeks. And you can see here the rates are very low, even at 3 months, which is only half of the current recommendation. And we sort of see this equality happening, but unfortunately it's for the wrong reason. We don't want to see such low rates of exclusive breastfeeding. Next slide. Another piece of information that we looked at in the blueprint were hospital practices in Illinois, specifically breastfeeding supportive practices. So in the blue, we see here, these are practices that promote breastfeeding, and this is showing what percentage of hospitals in Illinois are implementing these breastfeeding supportive practices. So you can see we're doing pretty well in terms of rooming in and breastfeeding in the hospital. Those rates are high. But where the struggle seems to be is exclusive breastfeeding in the hospital, only 34% there. And then on the right-hand side, these are practices, breastfeeding practices that discourage breastfeeding. And just to give you a sense, in Illinois, 84% of hospitals are giving out formula gift packs. I think that's changed since these data, but we'll have to wait and see. And also pacifier use was pretty high as well. Next slide. So from the data that we collected, we used this data to develop recommendations where we felt like improvements needed to be made in order for the state of Illinois to be more supportive and promote breastfeeding. So we broke these down into 5 categories. 1, hospital, clinics, and health professionals. 2, state, county, and local government. 3, community-based organizations and families. 4, workplaces, and 5, insurers. And the rest of my presentation will focus on the improvements that we've been making in hospitals due to the CPW project. You can go ahead to the next slide. As part of the blueprint, we did also develop a website, and you can access a copy of the blueprint there, as well as further information on the data, the quantitative and qualitative data, and more information about what's going on in the state, events that are taking place. So I encourage everyone to take a look at the website. Next slide. So once the blueprint was developed, we started thinking about how can we implement these strategies, these recommendations that we've identified. And so we're focusing on a variety of actions. We are focusing on looking at the data and using that data to determine what needs to take place, and also media involvement. And what we've seen is that we feel like Illinois has reached a tipping point for breastfeeding promotion. Next slide. So now I'm going to talk a little bit about how the blueprint has been used to develop infrastructure and change throughout the state. Next slide. So HealthConnect 1 is one of the technical assistance partners on the CDC-funded Communities Putting Prevention to Work. And this is taking place in suburban Cook County as well as in the city of Chicago. They're two sister projects. And these are obesity prevention projects focusing on policy systems and environmental change. And the breastfeeding piece has focused on hospital practices. So there's been a number of partners involved in both the projects. HealthConnect 1, the Illinois chapter of the American Academy of Pediatrics, as well as the Illinois Maternal and Child Health Coalition are the breastfeeding technical assistance partners on the project. Next slide. So all of these different partners that involved bring a different expertise to the project, which has been very beneficial in terms of attacking the issue on different levels. For HealthConnect 1, we are experts in community-based programs, particularly breastfeeding peer counselors, and we have been working in breastfeeding change promotion for 25 years. The Illinois Maternal and Child Health Coalition, they focus on statewide policy and advocacy. And then our other partner, which was Illinois chapter of the American Academy of Pediatrics, they're a provider organization, so they help bridge the gap between the project and providers in the state of Illinois. Next slide. So like I said, the CPW projects are focused on evidence-based breastfeeding promoting hospital practices. And so we are still in the process of helping hospitals implement the BabyFriendly Hospital Initiative. And I'm sure most of you are familiar, but just to go over it, the BabyFriendly Hospital Initiative includes 10 steps that are evidence-based. There's overwhelming evidence to support these practices in improving breastfeeding outcomes. And to give you a little perspective, globally there's over 2,000 facilities. And then, but in Illinois, like I mentioned earlier, we have only about 1.5% of live births happening at baby-friendly designated hospitals. Next slide. So just to go over the steps really briefly, step 1 is having a written breastfeeding policy. Step 2 is training all healthcare staff in skills necessary to implement this policy. Step 3, inform all pregnant women about the benefits and management of breastfeeding. Step 4, help mothers initiate breastfeeding within an hour of birth. And this also includes immediate skin-to-skin contact after birth. Step 5, show mothers how to breastfeed and how to maintain lactation even if separated from their infant. Next slide. Step 6, give newborn infants no food or drink other than breast milk unless medically indicated. Step 7, practice rooming in. Step 8, encouraging breastfeeding on cue. Step 9, give no pacifiers to breastfeeding infants. And finally, step 10, fostering the establishment of breastfeeding support groups and refer mothers to them on discharge. So these are the steps that we are focusing on helping maternity hospitals in Cook County implement through the CPW project. Next slide. So a few key considerations for implementation that I wanted to highlight. Just as the project was a multidisciplinary, had multidisciplinary partners, we also encourage hospitals to form multidisciplinary committees, including people within the hospital and also people from outside of the hospital and from the community, such as WIC staff. And the reason that this is so useful is that implementing the Baby-Friendly Hospital Initiative is not just the lactation department's project. It is a hospital-wide project, and you need everyone's perspective in order to move the project forward. and also to help distribute tasks, because the lactation consultant cannot take this all on by themselves. It needs to be something that is bought into from administration to nurses to managers, and everybody's playing their part to help implement it. Another key consideration is policy revision, making sure that hospitals' policies are evidence-based and up-to-date. This is really important because policy is guiding the practice that is happening on the floor. Another important piece that we emphasized was data collection. Data collection of all these practices, such as skin-to-skin, exclusive breastfeeding, rooming in, making sure that a hospital is aware of how often they're practicing these baby-friendly steps, and this helps hospitals to identify where they need to make improvements, but also for them to be able to highlight where they're having successes. And finally, as part of the CPW project in Chicago, we used hospital incentives, and this was a small grant to the hospitals that were interested in going for baby-friendly. We helped hospitals to pay to move into the second phase of the 40 pathway for baby-friendly. And we found that even though it was a small amount of funds, this really helped catapult hospitals into that second phase of baby-friendly designation, where things really start moving. And other incentives that we used were we provided 3 certified lactation counselor trainings throughout the grant period, as well as a training of trainers that's actually going on this week, where hospital staff is trained to be able to help train their staff on the requirements, the training requirements for baby-friendly, which is 20 hours for each staff member. So that training of trainers will help with sustainability once this particular project is over. Next slide. Another piece that the Illinois chapter of the American Academy of Pediatrics led was the development of the Illinois Physician Statement on breastfeeding, and you can actually link to that from the slides. The Illinois Physician Statement on breastfeeding pulled together the 3 major provider organizations in Illinois, ICAP, the Illinois Academy of Family Physicians, and the Illinois section of ACOG. All 3 of these major provider organizations signed on to this statement, and I don't believe there's any other state that has anything like this yet. So it was very monumental to get all of 3 of these provider organizations together and to sign on to this statement. So this is a great success. And what this statement talked about was basically the provider's role throughout the continuum of care for breastfeeding, preconception, prenatal, in the hospital, as well as post-discharge. And one thing that it recommended, which I want to point out, is that providers discuss with their patients the feeding decision at all prenatal visits. So I thought that was really big to try to encourage providers to do that, because one of the things that we were hearing throughout this project has been that mothers had not discussed their feeding decision in prenatal visits prior to admission to the hospital. Next slide. So just to give a little bit of progress about what has happened with the project in Illinois pertaining to baby-friendly, starting in June of last year, the project partners developed what we call the Hospital Breastfeeding Council of Metro Chicago, and this brings together breastfeeding champions on a monthly basis from the Chicago area, and there's guest speakers, group discussion, and what it has become is a peer-to-peer support network 4 hospital staff that are working on implementing the BabyFriendly Hospital Initiative. So for example, there is a hospital that was successful at implementing rooming in. And so a representative from that hospital came to the meeting and shared with the group what they've learned, the challenges they came across, and also strategies for overcoming those barriers. So it's become a really great network, and people are very excited about it. Some more progress that was made was pertaining to breastfeeding peer counselor programs. Throughout this project, there have been 3 hospitals with newly implemented breastfeeding peer counselor programs. And this pertains to addressing step 3 and step 10 of the BabyFriendly Hospital Initiative, having a peer counselor speak to a mother prenatally, as well as having a peer counselor available for support for mothers after they have been discharged from the hospital. Next slide. I wanted to highlight a few of the emerging hospital strategies that we've identified through the hospitals that we've been working with. One being what is being called either the golden hour or the sacred hour. Implementing skin-to-skin and the first latch in the first hour after birth was one of the practices that across the board hospitals were working on. And as a way of marketing that to parents, it was called either the golden hour or the sacred hour. Hospitals had been coming across barriers where visitors wanted to be there right after the baby was born and sort of pass the baby around, which inhibited doing skin-to-skin within the first hour and initiating breastfeeding within the first hour. So a number of hospitals, what they did was develop this golden hour that was just the mother and the baby and maybe a support person. And this hour was dedicated just to them getting to know each other, and the visitors would have to wait until that hour was over to see the baby for the first time. And that actually works really well in a number of hospitals. Another strategy that has been used is family rest time. This usually consists of a time in the afternoon that is free of visitors as well as staff, hospital staff. It's just a dedicated time for the mother and the baby to be together, undisturbed, for breastfeeding. But again, visitors come up quite frequently that they may prevent a mother from wanting to breastfeed in front of the visitors or tire out the mother, so she might want to send the baby to the nursery for the night. So this is a technique that gives them undisturbed time to breastfeed. And then finally, a number of postpartum support groups have been developed throughout the process. This is great for mothers to talk with other mothers, and was also significant because a mother could come and get their baby weighed if this is a hospital-supported support group, and that seems to help alleviate some mothers' anxiety around their milk supply and whether or not their babies were eating enough. Next slide. So in terms of baby-friendly designation, a number of hospitals have entered into the 40 pathway for designation. In Chicago, we have 13 out of 19 hospitals in Chicago on their way to baby-friendly, some in the development phase, some in the discovery phase, but that's nearly 70% of the hospitals in Chicago. This has far exceeded, I think, any of our expectations. Also in Cook County, suburban Cook County, we have had 3 out of 16 hospitals work towards and have entered the 40 pathway for designation. And there's actually one hospital that is patiently waiting to hear the results of their on-site assessment. So they're very close. Some more progress that was made in Illinois. 3 out of 10 Perineal Networks started breastfeeding quality improvement projects in 2012. In Illinois, we have 10 perinatal networks, and these are comprised of a number of hospitals and then one perinatal center. And so there's probably about 5 to 10 hospitals in each perinatal network. And they started working on 5 out of the 10 steps in 2012. But on a broader level, in the spring of this year, the Perinatal Advisory Committee approved a statewide breastfeeding quality improvement project for 2013. Next slide. And this gives you the steps that are going to be included in the Breastfeeding Quality Improvement Project for 2013 that the State Quality Council is asking all maternity hospitals in Illinois to work on implementing these steps in 2013. And that includes skin-to-skin, initiating breastfeeding within 60 minutes, rooming in, breastfeeding on cue, and then promoting exclusive breastfeeding. So in 2013, all hospitals will be working on these steps. Next slide. So I just wanted to stop for a minute and focus on the perinatal networks because the perinatal networks ended up being an infrastructure that was really great for moving these projects forward within the state. And I just wanted to highlight how they were utilized throughout the state. So it's a built-in system for statewide quality improvement. Perineal networks meet on a quarterly basis typically, and this forms as an opportunity for information dissemination about different projects and about what's going on throughout the state. It's also a mechanism for hospitals, if they come across barriers, to strategize with the other hospitals in the network and help find solutions to address these barriers. And finally, it's also an accountability mechanism. Hospitals that are asked to report on a quarterly basis the progress that they've made helps build in accountability for the project. Next slide.
Are you still there, Sadie?
I'm sorry, I said next slide.
Oh, it's there, the hospital toolkit.
Oh, okay. It's not. I'm not showing it on my computer. So sorry. Let me just turn to my handout.
Yeah, it sounds like your computer may have a bit of a lag, but yeah, it's showing that 99% of attendees are seeing the toolkit.
Okay. Okay. I'm seeing it now. Thank you. So as part of what we've learned from the CPPW project in Cook County, HealthConnect 1 is leading the development of a hospital breastfeeding toolkit. And this is going to be a virtual toolkit that's going to be available on the Illinois Breastfeeding Blueprint website. And basically what we wanted to do was pull together everything that we've learned in Cook County and be able to spread that across the state for hospitals that will start working on these projects in 2013. And so this toolkit will be available in the fall on the Blueprint website. And it'll include a number of different resources, work plan templates, and different strategies that we've identified through this project that can hopefully help the rest of the hospitals in Illinois. Next slide. Moving on to statewide policy, I wanted to highlight a few of the statewide policy initiatives that have been going on in the last few years in Illinois. One being that initiation rates for breastfeeding are available on the Illinois Hospital Report Card. That means any consumer can go on the Illinois Hospital Report Card website and search for hospitals that they're thinking about delivering at and seeing what their initiation rates are. And I will say that I did hear a story from one of the hospitals that I'm working with that she had 2 patients actually that said, we decided to deliver at your hospital instead of the neighboring hospital based on the breastfeeding rates that were reported on the Illinois Hospital Report Card. So this built in a little bit of transparency for hospitals, and it helps consumers in terms of finding out hospitals that are supportive of breastfeeding. Another important piece of legislation was the Hospital Infant Feeding Act, and this is effective as of January 1, 2013. And what this does is requires all Illinois hospitals, all maternity hospitals, to adopt a policy that promotes breastfeeding using guidance provided by the BabyFriendly Hospital Initiative. So what this means is that starting in January, all hospitals will have to have an infant feeding policy that follows guidance of BabyFriendly. And this essentially is implementation of step 1 of the BabyFriendly Hospital Initiative across Illinois. Next slide. This slide, I'm just talking a little bit about what's coming up in Illinois pertaining to statewide policy and breastfeeding. We are working on getting exclusive breastfeeding on the Illinois Hospital Report Card. Currently, it's just the initiation rates, whether there was any breastfeeding or not. But we're moving towards getting exclusive breastfeeding, so they'll be able to report what percentage of infants were exclusively breastfed, what percentage of infants were breastfeeding and formula feeding, and then what percentage were just formula feeding. So the state is in the process of revising the birth certificate to redo the question that is asked. And this will actually, we're using the New York model, the New York question, since they have already started collecting exclusive breastfeeding. So that is in the process right now. And then moving forward, there'll be the implementation of the Community Transformation Grant in Illinois, which is another CDC-funded chronic disease prevention grant. And they just awarded the grantees for Illinois, and there are 4 county health departments in Illinois that will be focusing on the baby-friendly implementation. So we're looking forward to seeing what that brings. Next slide. I also wanted to highlight some of the media attention that was given around this project in the Chicago area. There was a number of Chicago public radio stories pertaining to breastfeeding and baby-friendly in the last 1.5 years or so. And I felt that this brought some healthy competition across the hospitals in Chicago. There was an article about the initiation rates of Chicago hospitals, and there was a few about different hospitals that were moving towards baby-friendly. And finally, there was a piece that was done about the new Infant Feeding Act policy that's going into effect in January. So the media attention, I think, was very beneficial. My mom said to me, she said, is it because you're working in breastfeeding, or do I just keep hearing everything about breastfeeding? So I think it's a good sign that this is sort of on everyone's radar at this point. Next slide. And just to wrap up, HealthConnect 1 is having our 2nd annual breastfeeding photo contest for World Breastfeeding Week. And this is one of our efforts to normalize breastfeeding. And I would encourage everyone, and voting ends tomorrow, but you can go on our website and vote for different entries and take a look at all the photos that have been submitted. So I would encourage everyone to take a look at that and vote today and tomorrow. Next slide. This is the website for the blueprint and also my contact information if anybody has any more specific questions they'd like to talk to me about. So thank you.
Wonderful. Thank you, Sadie. Can you hear me?
Yes.
Okay. This is Megan Renner again. I'm just going to pop open the questions box here and remind folks that you can go ahead and type questions into the questions box on your webinar control panel. If you have questions for Sadie. While I'm actually sorting through these a bit, I actually want to ask a question about the media attention that you just showed. As some of you know, I actually am located in Chicago, so it's been wonderful the last year or so. Every time I turn around, my husband's calling me saying, there's another story on NPR. Turn on the radio. So, you know, kudos to my Chicago colleagues for all of the great media attention. I'm just curious if you know, Sadie, or if you can talk a little bit about how that relationship developed. It seems as if many of the stories were Chip Mitchell here at WBEZ, and I'm curious if that, you know, and he seemed to be very much on board with the messaging and ready to be involved and responsive. So I'm just curious if you can talk a little bit about that reporter relationship.
Sure. So our communications manager had reached out to him last year when we were about to launch the Illinois Breastfeeding Blueprint, and she had developed a relationship with him, had some conversations with him, talked back and forth with him, and he had sort of, you know, picked up on what was going on. And also the CPW bona fide agency clock, they also have had a relationship with him as well. So it was sort of, you know, checking in with him, he would check in with us, and we sort of let him know if something major was going on, and he'd try to figure out how he wanted to tell that story. So it was definitely relationship-based and just keeping in touch, finding that reporter that is talking about issues that relate to your work and trying to figure out how to make it mutually beneficial.
Great, thanks. Let's see. There's a question about how did you choose which hospitals received the small grants?
Mm-hmm. So that was basically based on when we, at the beginning of the project, we sat down with hospitals and we did sort of a pre-test assessment of where they were at and sort of where they were interested in going. Some hospitals were clearly interested, that they were ready for designation and ready to go right away. And then there was other hospitals that, you know, weren't ready to do full-blown designation, but were interested in working on a few steps. So based on that initial assessment, the hospitals that were really interested in going for designation were offered the incentive.
This looks like a question from a similar part of the presentation. What type of education for the 20 hours? Was it online, PowerPoint? How does the train-the-trainer work to get the 20 hours?
So how the train-the-trainer works is hospital staff attend a week-long training, and they're basically, from there, they're equipped with the tools to go back to their hospital and teach their entire staff on the 20-hour requirements for BabyFriendly. That's not the only way to do it. Hospitals tend to do it in a mix of in-person education, online. There's a number of online resources, online modules, self-study modules. The education piece for BabyFriendly is one of the most significant and time-consuming pieces of going for BabyFriendly, and it seems like doing a mixture of different types of education has seemed to be what's worked best for most hospitals.
Okay. A question about the hospital initiation rates. Where does Illinois obtain the initiation rates from? Is it from the newborn screening test?
It's actually on the birth certificate, and then that's reported to IDPH, which puts that on the Illinois hospital report card. So it's from the birth certificate. Mm-hmm.
Okay. This was a question I had too about the Infant Feeding Act. How hard was it to get the bill passed? Did you run into any major resistance? Can you talk about that a little bit?
Mm-hmm. So that was primarily worked on by the Illinois Maternal and Child Health Coalition. They were a big player in that, and the way that they went about it was they were in conversations with the IHA, Illinois Hospital Association, prior to this legislation being introduced. And so I think that definitely helped that once it got introduced, there weren't any major barriers, and we actually had a lot more people signing on to it. So I think that was the key to that success, was keeping everybody involved from the get-go.
Great. There's a couple of questions about differences, different parts of the state. Can you share any reasons why there is a disparity between the percentage of Cook County suburban hospitals versus the City of Chicago hospitals that are registered for BabyFriendly pathway?
Mm-hmm. I think it's probably a number of different factors. The City of Chicago project started a little bit later than suburban Cook County, and so I think we learned a little bit more as we went. I think that even though they were small, the hospital incentives played a big part. I also think it may have something to do with, in Chicago, the vicinity that hospitals are to each other. They're very close, so people are very aware of what's going on in hospitals that are close to them. So I think that definitely could have played a part in this sort of momentum. And then most of the media also was in the Chicago area. So I think it was just the other piece that I will mention too is that in the city, the Chicago Department of Public Health was very involved and part of the strategic planning committee for the project, and the commissioner has also been a really big supporter of the project. So I think those were some of the factors that may have contributed to the difference.
Gotcha. So a similar question about sort of upstate in the Chicago area versus downstate. I know you said that there are 4 other counties that are getting community transformation grant funding. Can you talk a little bit about the Chicago area versus the rest of the state, and how that dynamic is working with the project?
So the 4 counties that are grantees for the Community Transformation Grant, one of the counties is in southern Illinois, one's sort of in the middle of Illinois, and then one's to the northwest. 2 of them are to the northwest. So I definitely think that it's great to see that some of this funding opportunity is being spread out to the rest of the state. And we're not sure. We're really curious to sort of see how that plays out for the rest of the state. I know for the city, it was easier logistically that we were in the City of Chicago and suburban Cook County in terms of organizing. So I think it'll be really important in terms of communication and networking as this rolls out to the rest of the state, which will be, there's a lot of distance between those counties that will be doing the Community Transformation Grant.
That's not an uncommon problem, uncommon situation.
Yeah.
Oh gosh, we have a lot of good questions. I'm going to try to hit some of the similar ones here. I know you mentioned the virtual hospital toolkit. That's not yet available on the site. Is that?
No, it's in draft form still, and that will be available sometime this fall.
Okay.
And that will also be on the Illinois Breastfeeding Blueprint website.
Okay. Are there hospitals that allow community-based breastfeeding peer counselors into their hospital to help new mothers?
Yes.
I think they're specifically asking about WIC, it seems.
I can't speak to WIC, but I know that the new breastfeeding peer counselors that have been implemented during this project period, that the peer counselors, in one case, the peer counselor works at the clinic that's in the hospital, so she sees mothers prenatally in prenatal visits at the hospital, during the hospital stay, and also postpartum. So that's sort of been a great thing that when it's a hospital-based peer counselor program, then the peer counselors have access to counseling the mother throughout the whole process. So yes, in those new programs, the peer counselors are available to the mothers in the hospital.
Gotcha. Let's see. How difficult was it to get the state to agree to publish the hospital report card rates of initiation? And the same question for rates of exclusive breastfeeding at discharge. Did the state acknowledge that competition moves hospital practices? Was it Department of Public Health, other agencies that were involved in facilitating this process?
So some of those meetings happened prior to me joining HealthConnect 1, so I can just speak to what I know from what I've heard, but I'm not sure exactly. But I definitely think the initiation rate, getting that on the hospital report card, wasn't too challenging. Getting the exclusive breastfeeding rate is a little more challenging because it involves changing the way that the question is asked on the birth certificate. So the Illinois Department of Public Health is in agreement with it, but it's just taking a little longer electronically, the technology around changing how the question is asked on the birth certificate. So I think that's been the bigger barrier, but overall it seems like the state has been supportive. There's a number of different variables that are available on the hospital report card. The breastfeeding initiation rates are just one of them. So I think they were, from what I can tell, they were pretty supportive.
Okay. I know we're running out of time. We do have a few announcements. I have one more question here. I know there are a few others where we're not able to get to, but we do have Sadie's email address in the slides. And I will quickly also remind folks that the slides are available on the website. If you go to the usbreastfeeding.org website and click on the quick links on the bottom right, you'll find State Breastfeeding Coalition webinars, and you can click there to access the slides. I'm going to do the last question here. Where was it? Can you say a little bit more about how the 3 physician groups got together to issue one joint statement? Was this initiated by HealthConnect 1 or by the project, and how, were there barriers to that? How did that go?
So that piece of the project was led by ICAP, the Illinois chapter of the American Academy of Pediatrics. And if you had any more specific questions about that, I could get you in touch with the lead there. But from what I know is they invited participants from the other 2 organizations as well. And there are sort of these working group committees that worked towards developing the statement with input from all 3 of the organizations. So I think that developing relationships and working with people from the different groups and getting all their input, that was sort of the process of how that came to be.
Yeah, and it didn't seem to be an easy process. I know I was copied on some of the drafts as it was going through, but definitely a great accomplishment for the project. Well, I'm going to just make one quick announcement from USBC and then turn it over. I know CDC has a couple of announcements as well, but again, we're as everybody knows, we are just coming off of the National Coalitions Conference last week, and we very much thank everyone who attended and participated and spoke. It was a great event, and you will be hearing more from us in the weeks ahead. We're really just getting back into the office this week and getting reorganized here at USBC, but did want to highlight one thing that is going on throughout National Breastfeeding Month, which is the National Breastfeeding Month campaign. Everyone can help make breastfeeding easier, the 20 actions in 20 days. Social media campaign. I spoke about this briefly on the last webinar, and just want folks to know that even if you haven't logged into it yet or connected to it yet, it's not too late. It's only the second week of the 20 actions, so you haven't missed very much, and I do encourage folks to check it out. There are a lot of different ways to participate individually or as your coalition or organization. It doesn't take a lot, so we encourage you to visit the link and at the bottom of the screen and check it out. And again, thank you so much, Sadie, for speaking. I'm sorry I forgot to say that. And we very much appreciated your presentation, and we will turn it over to CDC for their announcements next.
Thanks, Megan. Hi, everybody. And Sadie, thank you so much. That was really valuable information. I think we can all benefit from learning from Illinois and Chicago. I just have a couple of quick announcements. We're ending up, we're at the top of the hour almost. I just wanted to mention that those of you who've been following the Best Fed Beginnings Learning Collaborative project, just to let you know that we did separate the hospitals that made it in, the 90 hospitals, into 3 regions, Region A, B, and C, and they will be starting their learning sessions. So Region A has its learning session in Atlanta on August 29th and 30th. Learning Collaborative B will have their first learning session on September 6th through 7th in Baltimore, and Learning Collaborative C will have theirs on September 11th and 12th in St. Louis. And the part I wanted to mention to you that I think is something really good that we're doing, we've invited a state breastfeeding coalition representative from each of the states that has hospitals, 1 or more hospitals in the Learning Collaborative, to attend the first learning session. The first learning session has a face-to-face leadership track, and we are planning on having the coalition representative participate in the leadership track. Our primary reason being for, and this is an opportunity for the coalition folks to talk to each other, but also for the hospitals, the leadership of hospitals, to be given a chance to recognize that there is expertise and leadership for breastfeeding in their states, and that the coalition is the source of that. The second thing I wanted to mention was, you all know the breastfeeding report card came out, and Sadie used our most recent information. I wanted to thank everybody for taking on using the breastfeeding report card as soon as it came out, and several of your states have actually put out really good press releases, and we've gotten some really good coverage from around the country. We would welcome your sharing that information with us, because we do a media search for press releases and for articles, but we may miss some of those. But it's a really good way to collect information on how the reach of the breastfeeding report card and what you're doing with it. And I think that's all I have for now. Megan?
And thanks again, Sadie, and to everyone for all the great questions today. We do not have regional calls this month. We are taking a hiatus since the regions just met last week at the Coalitions Conference in person, but we will be back for our next call in October. So thanks again, everyone, and have a great rest of National Breastfeeding Month. Take care.